Hello everyone, I'm David and welcome back to another first aid skills video. Last week we went over the first half of that scenario I did a few weeks ago, which was recognizing the scene safety, coming up, seeing if the person needed help, telling bystanders to go get you first aid kits, an AED, and call 911. Now we're going to go over the actual process of CPR. So we've done all that, and as soon as all that's done and everybody's off to help you out and do what you've asked them to do, we want to get right into it as fast as we can. Now, with the first aid kit, typically when that shows up, you'll want to use one of these, which is a pocket mask or a barrier device. So what it is it's just a little thing like that fits over someone's face like that. Their nose goes in that nose cup, goes around their chin, and we blow into this, which is a one-way valve, so nothing can come back into you. So you want to use this typically for people we don't know, just to keep ourselves safe. If it's someone you know, feel free to just do straight mouth to mouth, and when you're doing straight mouth to mouth, it's just that head tilt chin lift again. You want to pinch their noses to block the air from coming out, and then get a nice seal on their mouth and blow in. If we don't know them, you can take the chance if you want, or you can just do compression only CPR, which is just strictly compressions over and over and over again, which is also acceptable. You can do that if you're not comfortable doing mouth to mouth or even using a barrier device. But typically you always want to protect yourself. They can be this big, they can be just a little sheet of plastic that goes over with a little valve on it. And when you breathe in, you give your breath, no matter, even if you're using these or just those little fake ones or just straight mouth to mouth. When you breathe in, always turn your head after you give that breath, because that air might come out and stuff might follow it, and you'd rather get hit here than get stuff in your mouth. So when doing the compressions, we want to line up the heel of our palm in between the nipple line. So find where the nipples are, meet right in the middle, and that's where you want the palm of your hand to be. The other hand can just wrap in the fingers, and you want to be straight up above the person. And when you're giving compressions, you want to push straight down, and you don't want to use your elbows, because if you start using your elbows, you don't really get as deep as you want. You want to go straight down and push hard in, because when we're doing CPR on an adult, we want to get at least 5 centimeters down into their chest. And on young adults, that's typically pretty hard to do, is to push that hard because the rib cage is really firm. So we want to make sure we push hard, deep, 5 centimeters. And when you come back up off, make sure you get full recoil in the chest. So we push in, we compress it. We want to be able to come up so the chest fully fills again, so the heart can fill with blood completely. What a lot of people do is they'll do their good depth of compressions, but they'll only come up part way, not letting it come all the way. And that means the heart doesn't fill with quite as much blood as it possibly can. And so now we're kind of just short pumping the heart. We're letting it fill up a little bit, and then we're just getting little pulses, where if we go full recoil, we're letting the heart fill all the way up before we compress the blood throughout the body again. Now the rate we want to do those compressions is 100 to 120 beats per minute. So this is what 100 beats per minute sounds like. So that would look like this. So that's what 100 beats per minute sounds like. So if you watch the video, I was closer up to 120 beats per minute, but as long as you're in that range, it's okay. Now for our ratio, if you're not doing compression only CPR, is 30 compressions to 2 breaths. So we'll count out. And it's also good to count in your head to keep track. And if advanced care shows up, they can know kind of where you are based on what you're counting. So we'll start with 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So we do our 30 compressions. If you have your mask, go for it, use it, put it on. You want to get a nice hard seal on the top, so it helps if you make kind of a C. You can push the mask down on. Do your tilt, head tilt, chin lift, make it a good seal. 1 breath. Look to the side. Watch for that chest start to rise, and that typically means you've given enough breath. And a breath should be about a second long. So you go 1 breath, watch for the chest to rise, it'll fall again. Another breath, watch for chest rise, it'll fall again. There's your 2 breaths, and go right back into it again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Grab your mask again, get your good seal, head tilt, chin lift, breathe, watch for chest rise. Watch it go back down, watch for chest rise, watch it go back down. Now, if the chest doesn't rise on your first breath, so let's say we do our lift, no rise, you want to just do a readjust. So you put the person's head back down, we're going to seal again, head up, breathe again, watch the chest rise. If it rises your second try, awesome, continue CPR. If it doesn't rise, still continue going on with CPR, and keep trying to get that breath in. Again, 2 attempts, we don't want to do any more because compressions is the most important part, and we don't want to delay compressions too much. So that's basically it for how the compressions and breathing goes. So keep in mind, this is for adult CPR. Over the next couple of weeks, I'll go over children and infants. They're similar, but they're slightly different just because the anatomical changes in the body. You can't give quite as full breaths to infants. You don't want to push quite as hard or deep on infants and children. So we'll go over that in our later videos. Thanks again for tuning in this week, and I hope to see you all next time. Bye.